If your knees feel like it might be giving out, that is not something to ignore. Sometimes it's a minor issue, but other times it could mean a structural problem that will not fix itself. The challenge with knee instability is the feeling you are having could come from very different causes. In this video, I'm going to walk you through the top 4 reasons your knee feels unstable, and by the end, you should have a much clearer idea of what your knee is trying to tell you. Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician practicing in the Washington, D.C. area. The most common reason your knee feels unstable is a ligament injury, such as an ACL tear. The anterior cruciate ligament, or the ACL, is one of the main stabilizers of the knee. And when the ACL tears, the knee loses control of forward movement and rotation. This is the most common ligament-related cause of instability and accounts for over half of knee injuries in the United States. Most patients describe a very specific moment when it happened. There is often a pop followed by immediate swelling and then persistent feeling that the knee cannot be trusted, especially with pivoting or cutting movements. Even if you can still walk, the instability does not go away. And over time, it can lead to further damage inside the knee, particularly to the meniscus. The second major reason your knee feels unstable is a meniscus tear that causes mechanical symptom. The meniscus is a cartilage cushion in the knee between the femur and the tibia, and when there's a tear, it can interfere with how the joint moves. Certain types of tears, like a bucket handle tear, can physically block the motion, which creates a very different type of instability. Instead of just giving way, patients often describe catching, locking, or the knee getting stuck in one position. This happens because a piece of the torn cartilage can flip into the joint space. Meniscus tears affect about 12% of adults, with younger patients more likely to have traumatic tears than older adults, and more likely to have degenerative tears associated with early arthritis. The key difference is that the type of instability feels mechanical, as it is something that is physically in the way, rather than a loss of control. The third reason your knee may feel unstable is something called patellofemoral instability. This is where the kneecap shifts out of place. Patellofemoral instability is a condition where the kneecap does not track properly within the groove of the femur, leading to a sensation that is a slipping or shifting feeling. This is especially common in younger, active individuals and has a lifetime prevalence of about 25%. Patients often describe instability during activities like squatting, going up or down stairs, or changing directions quickly. Some people even feel the kneecap briefly pop out and then return to place. In adolescents with knee injuries and swelling is one of the most common structural causes. Even when it does not fully dislocate, repeated subtle shifting can damage the cartilage on the kneecap and increase the risk of early arthritis over time. The fourth reason your knee feels unstable is osteoarthritis, which can cause functional instability over time. Knee osteoarthritis is actually the most common cause of knee instability in adults over the age of 45. It affects millions of people worldwide, and about 61% of adults over the age of 45 show radiographic evidence of knee osteoarthritis. In this case, the instability is not due to a single tear, but rather a combination of factors, including cartilage wear, joint changes, reduced proprioception, which is sensation around the knee, and weakness of the quadriceps muscles. About 26% of people with symptomatic osteoarthritis report episodes of knee buckling or giving way. What makes this interesting is that even people without clear arthritis on imaging can still experience instability due to muscle weakness and poor joint control, which shows that not all instability comes from structural damage alone. The bottom line is that knee instability is a symptom that points to a specific underlying problem. Your knee is not randomly giving out, and each time instability has a pattern. The most important thing is that the longer true instability is ignored, the greater the risk of additional damage inside the knee. Getting the right diagnosis early makes a big difference in how easy it is to treat the knee and how well you can recover. What questions do you have about your health? Drop them in the comments below, and I'll do my best to answer them in a future video. Remember to hit and subscribe, and I will see you in the next one.